Dear chair members, dear audience, let me present you my 6 months progress. My PhD thesis title is New Insights into the Application of Teledermatology. I am Martyin. I am a medical doctor and a PhD student at the Department of Dermatology, Semmelweis University. I currently have 2 ongoing projects. The first one is comparing the diagnostic accuracy of teledermatology systems to face-to-face examination in the diagnosis of skin diseases through a systematic review and meta-analysis. Skin diseases affect a significant portion of the global population, with a shocking 3 billion people in the world lacking appropriate care. The number of dermatologists per 100,000 people shows the disparities between the access to dermatology services. This number is 7 in Germany, a mere 3.4 in the USA, and a mere 0.7 in Indonesia. The cost of a conventional dermatology visit is around $300, while the cost of a teledermatology visit averages around $40. In light of these factors, teledermatology stands out as a crucial tool in facilitating timely and affordable dermatological care, yet there is still data missing regarding its reliability in the everyday practice. Our clinical question is whether teledermatology systems are as reliable as face-to-face examinations. We use the PICO framework. Our population is patients with any kind of skin diseases. The intervention is diagnosis made via teledermatology, which is compared to diagnosis made via face-to-face examination. The outcome of interest is diagnostic accuracy. Our hypothesis is that teledermatology systems have non-inferior diagnostic accuracy to face-to-face examinations. We conducted a systematic search through the 3 main databases, which resulted in more than 30,000 records, and we were left with 211 eligible full texts after the selection protocol. We currently only have preliminary results regarding the skin cancer triage use of teledermatology, and there is still ongoing analysis about all skin diseases, teledermatology complemented with dermoscopy and other imaging techniques, and user satisfaction. So in our first forest plot, we investigated the proportion of diagnostic agreement between teledermatology and in-person examination for skin cancer triage. Diagnostic agreement means the proportion of the same diagnosis between the in-person and the teledermatology examination. 0% means a complete disagreement, and 100% means complete agreement. We investigated 4 studies. As you can see, 3 studies grouped all types of skin cancers together, while the Jobbite study grouped the different kinds of skin cancer independently. This may cause the high heterogeneity. The proportion of diagnostic agreement was found to be 0.83, which means that in 83% of the cases, the diagnosis was the same between the in-person and teledermatology examination. In our second and third forest plots, you can see that we investigated the sensitivity and specificity of teledermatology for skin cancer triage. A high sensitivity ensures that as few cases as possible are missed, and reduces the chance of overlooking serious conditions, while a high specificity may reduce unnecessary referrals, thus conserving human resources and false alarms. As you can see, the sensitivity was found to be 0.79, and the specificity was found to be 0.97. These high number of sensitivity and specificity confirms our beliefs that teledermatology is suitable for skin cancer triage. As we only have preliminary results, it's hard to determine the strengths and limitations of our study, but it's a definitive strength that it is going to be a very comprehensive meta-analysis investigating all types of teledermatology care, and we will be operating with a very large sample size. However, the challenge lies in the diverse study settings and the different reporting of outcomes. Based on the preliminary results, our conclusion is that teledermatology is suitable for the triage of skin cancer patients and that it should be implemented in patient care to increase accessibility. The implication for research is that standardized reporting of outcomes are needed. We are currently still working on the data extraction. Staying in the field of technological advancements in medicine, let me present you my second project, which is investigating the diagnostic accuracy of artificial intelligence systems in the diagnosis of skin diseases through a systematic review and meta-analysis. As you can surely experience, most aspects of our lives are affected by technology, even our professional lives. And one of the most discussed advancements of technology nowadays is the use of AI systems. These systems can have a very important role in the primary care because 65% of all patients with dermatological problems only consult their general practitioner, who has to make a decision on the urgency of the case. Because of this, they are in enormous need for a real-time diagnostic support, which can be provided by artificial intelligence systems. Artificial intelligence systems can not only be useful in primary care, but it may also assist dermatologists. And due to the shortage of dermatologists, there is a huge need to reduce the waiting times and enhance the diagnostic efficiency. Our clinical question is whether artificial intelligence systems are suitable for making a diagnosis. We use the PEERD framework. Our population is patients with suspected skin cancer. The intervention is AI, which is compared to the gold standard diagnosis made by a human, and the diagnosis of interest is skin cancer. Our hypothesis is that artificial intelligence systems have non-inferior diagnostic accuracy to dermatologists. The clinical implication would be the implementation of artificial intelligence-assisted systems to improve patient care. We are currently working on deciding whether this topic is feasible and constructing the appropriate search key. So in summary, I have two ongoing projects, one regarding to the accuracy of teledermatology and one investigating the diagnostic accuracy of artificial intelligence systems. Thank you for your attention, and I would like to finish my presentation with the words of Marie Curie: "Nothing in life is to be feared, it is only to be understood."
Thank you very much for your presentation. I would like to ask that I saw that in terms of the specificity and sensitivity of teledermatology, it was a quite wide range between like 60 to 90% approximately. So what do you suggest what they can do to improve these numbers in teledermatology, so the specificity and sensitivity?
Thank you for the question. I think that to improve the sensitivity and specificity of teledermatology systems, there should be standardized guidelines to the image capturing and the image interpretation, and also there could be trainings to use these kind of teledermatological services, and also integrating patient history would be very useful.
Thank you.
Thank you.
Congratulations for your presentation. My question connected to your first topic. Is it already used in Hungary? I mean, teledermatology.
Yes, thank you for the question. Especially during the COVID-19 pandemic, it was very much in use in the Department of Dermatology of Semmelweis University.
Thank you.
First of all, congratulations for your wonderful presentation. I have a question regarding of your first topic. What kind of secondary outcomes were measured in the articles, and do you plan investigating any of them in your meta-analysis?
Thank you for the question. The investigated secondary outcomes are very diverse in the selected studies, but the secondary outcomes which are investigated the most are time to make the diagnosis and patient satisfaction, as well as the patient and the doctor satisfaction. So these are the secondary outcomes which we are planning to investigate in our study.
Thank you.
Thank you.
Thank you for the presentation. I found it quite interesting. I would have a question regarding the first project, regarding teledermatology. So how consistent were the articles regarding the input? How standardized are the inputs of pictures or videographs in terms of quality, lighting, or other aspects? Thank you.
Thank you for the question. Unfortunately, they are quite diverse, as there are two types of teledermatology, or three. The store and forward method, when the connection is separated by time and space, the real-time method, and the hybrid method, which is the combining the two forms. So these are quite heterogeneous, and also they differ in the method of image capturing, because in a few cases there is a trained imager who captures the lesions, and in few cases the patients take the pictures themselves.
Thank you.
Thank you.
Nice presentation, congratulations. My question is regarding your second project. Since we can see the lesions directly, what do you think artificial intelligence can improve to dermatology?
I think that the focus of this meta-analysis will be the use of these artificial intelligence systems in primary care, because a lot of patients only consult their general practitioner, who does not have the qualification as well as a dermatologist. So they are in need of real-time assistance. Thank you.
Thank you for your presentation. Regarding your first outcome, the diagnostic agreement, what was the difference between the first and the last study? The first study was, the agreement was around 50%, the last study almost 100%. Do you have any potential explanation?
Yes, I think that this can be explained with the different disease grouping methods, because as you can see, the Jobai study investigated the skin cancer types independently. And for example, in the case of actinic keratosis, this has the worst proportion of diagnostic agreement, as it can be a disease which can be hard to diagnose. And at the last study, the skin cancer types are grouped together, and maybe there were less actinic keratosis cases in this study.
Thank you.
Thank you.
Thanks for your presentation. I'm just curious about the AI training. So, for example, here there are so many different examination agreements, right? So, did you check what kind of the training method of this AI tool? For example, if they use some cross-validation or any other method to training this AI?
Actually, this is not the result for the AI project, because the AI project is the second one. This is only teledermatology without the use of AI.
Yeah, but I noticed that your heterogeneity is large, you know. So
yes.
I think you have to check, because the agreement is significantly associated with the method of training your model. Yes, I think so.
But this is not an artificial intelligence model.
But I mean, your second project, the AI.
But we don't have results yet for the second project.
Oh, okay. So I mean, you should notice that. So, yeah,
okay,
yeah.
Thank you for the comment.
Yeah, because you also need to do such results like in your second project. Yes, that's in my experience too. I was just curious about that. Sorry. Yeah.
Thank you for the comment.